Do you know what the ABCDE approach in emergency medicine is? It's a critical tool used by healthcare providers to swiftly assess and manage patients in emergency situations. This systematic approach ensures that life-threatening conditions are quickly identified and treated. The ABCDE stands for airway, breathing, circulation, disability, and exposure environment. Starting with A, for airway, healthcare providers must ensure the patient's airway is open and clear. If it's blocked by the tongue or foreign objects, quick actions are taken to clear it with techniques like the head tilt, chin lift maneuver, or the jaw thrust technique. Sometimes an oral or nasal airway may be inserted to maintain patency. B represents breathing. Here, the patient's breathing is assessed by observing the rise and fall of the chest and listening for breath sounds. If the patient isn't breathing or their breathing is inadequate, rescue breaths are given, often with the aid of a mouth-to-mouth or bag valve mask ventilation. Supplemental oxygen is provided when needed. The C stands for circulation. In this step, signs of circulation, such as pulse and skin color, are checked. The patient's level of consciousness is assessed, and signs of shock, such as pale or mottled skin, are looked for. If there is no pulse, chest compressions are initiated to keep the circulation going. D is for disability. The healthcare provider assesses the patient's consciousness level using tools like the AVPU or Glasgow Coma Scale. Any signs of neurological deficits like unequal pupil size or abnormal movements are evaluated along with potential head or spinal injuries. Lastly, E stands for exposure environment. The patient may need to be undressed for injury assessment and treatment. It's crucial to maintain the patient's body temperature and protect against hypothermia. Environmental factors that may contribute to the patient's condition are also considered. Apart from the ABCDE approach, basic life support or BLS, and automated external defibrillator or AED, procedures are vital in emergency situations. If a patient is unresponsive and not breathing normally, BLS is initiated, focusing on airway, breathing, and circulation. Chest compressions are performed at a rate of 100 to 120 per minute, with a compression depth of at least 2 inches in adults. An AED is used as soon as possible, if available. In case of cardiac arrest, the BLS guidelines for CPR and use of an AED are followed. CPR cycles are performed with interruptions for rhythm analysis and AED use. CPR is continued until advanced medical help arrives or the patient shows signs of recovery. By following the ABCDE approach and integrating BLS and AED procedures when needed, healthcare providers and first responders can effectively assess and manage patients in critical conditions. This not only improves the chances of survival, but also aids in recovery.